Alright, let's see about cysts of orofacial region. First, before that, we have to know what is cyst. Cyst is nothing but a pathologic cavity filled with liquid, semi-liquid or gas. Simple, right? Now let's see the classification. It is broadly classified into odontogenic and non-odontogenic cyst. Under odontogenic cyst, it is divided into developmental and inflammatory origin. So under developmental, we have odontogenic keratocyst, orthokeratodontogenic cyst, calcifying epithelial odontogenic cyst, dentigerous cyst, eruption cyst, lateral periodontal and lateral periodontal cyst. Now, coming to the inflammatory origin of odontogenic cyst, we have radicular cyst, residual cyst, apical periodontal cyst, and inflammatory collateral cyst. Simple. All right, you have to keep these in mind for the odontogenic cysts. Now let's see the non-odontogenic cyst. So this is also similar to odontogenic cyst when compared to the origin, which is developmental and inflammatory. So under developmental, we have nasopalatine cyst, nasolabial cyst, thyroglossal duct cyst, and globulomaxillary cyst. Now from the inflammatory origin, we have mucus extravasation cyst, mucus retention cyst, and aneurysmal bone cyst, ranula, and salivary cyst. In the miscellaneous classification, we have Staphnese bone cyst, anterior lingual depression. This is all about classification of cysts in the orofacial region. Okay, now let's see the odontogenic keratocyst, radicular cyst, and dentigerous cyst as a difference, so it will be easier to remember. So the OKC, it is now let's write about the division first. It is a odontogenic developmental cyst, same as in radicular. It is a odontogenic inflammatory cyst, and dentigerous, it is a odontogenic developmental cyst. So that's the where they originate from, that we've written. Now we have to know where it how it originates, like the pathogenesis. So it is from the primordium of tooth germ, remnants of dental lamina. Primordium of tooth germ and remnants of dental lamina for OKC. In radicular cyst, it is, as we know, it is an inflammatory origin. And then the dentigerous cyst originates from the fluid between reduced enamel epithelium and the crown. Now coming to the clinical features, the OKC and dentigerous has their developmental cyst. They both have almost similar clinical features. So they both have same second and third decade. Male is affected more than female, and mandible is the most common site for both of them. When coming to the radicular cyst, the age when it affects is third decade, fourth and fifth decade. There is 30, 40 and 50 years, and then there is no sex predilection. Like both are affected equally, and both maxilla and mandible is affected in radicular cyst. So the site where the radicular cyst appear is non-viral tooth and carious tooth, and in dentigerous cyst it is impacted teeth. Now coming to the histopathological feature. So if you have studied about the OKC, radicular cyst and dentigerous cyst, you would have known the outline of the histopath. Now they'll be having a parakeratinized layer which is corrugated. That is one point. And then the basal cell appears to be palisading, and the nucleus is polarized, so they give a tombstone appearance, like a tombstone appearance. And then there is subepithelial split here, and the satellite cyst is seen in the connective tissue. This is a major point here, because this is responsible for the aggressiveness of the OKC, satellite cyst. Now coming to the radicular cyst, so there is cholesterol cleft seen in the connective tissue, and then if you see in the epithelial region, there is connective tissue enclosed within the epithelium. So it's nothing but like this. This is the epithelial cells enclosing the connective tissue, fibers and all of the things. It's like this. Now coming to the dentigerous cyst, so this is the outline, and the epithelium, the lining epithelium will resemble the reduced enamel epithelium. As we saw the origin of this dentigerous cyst, that is like from where it starts, we saw that it is the fluid between reduced enamel epithelium and crown. So the same point here, the lining epithelium resembles the reduced enamel epithelium and the connective tissue obviously, and there is odontogenic islands in the connective tissue of dentigerous cyst. That is all about histopathology. Now let's see the radiologic feature of all these three cysts. Now coming to the OKC, it is unilocular or multilocular. It can be unilocular as well as multilocular, but radicular and dentigerous cyst both are unilocular. So when the OKC is multilocular, it gives a soap bubble appearance. So as we all know, cysts, they give radiolucency. All three will have radiolucency, but in this OKC there is multilocular radiolucency with soap bubble appearance. There is another similar soap bubble appearance, another similar radiologic feature where multilocular soap bubble appearance is seen, that is in ameloblastoma. That is a tumor. Now in cyst, this OKC gives this feature. And there is four types in the OKC. It is envelopmental, replacement, extraneous, and collateral. So these are the four radiologic types of OKC. There is no types in the radicular cyst, just the radiolucent, unilocular radiolucency. And in dentigerous cyst, there is unilocular radiolucency, and there is three types. There is central, lateral, and circumferential. Central, as we saw, like it covers the impacted tooth, right? So if you consider this, so if you see the central type, the dentigerous cyst is like this. And if you see the lateral type, say this is the tooth, lateral covers like this. And if you see the circumferential type, covers the whole tooth like this. These are three types in dentigerous cyst. And the treatment for all the three is, if it is a small cyst, enucleation, and if it is large, it is excised or marsupialization is done.